We are live. Okay, excellent. Today is Wednesday, February 8th, the 8th of 2023. And this is the Senate Government Operations Committee. And we're here with Commissioner Beth Fastiggi from the Department of Human Resources. And we're just going to introduce ourselves. I'm Senator Ruth Hardy from the Addison District.
Olivia Parker, Committee Assistant.
Senator Rebecca White from Windsor County District.
Senator Bob Norris, Franklin County.
Ann Watson, Washington District.
And this is Senator Clarkson from Windsor and Senator Vyhovsky from Chittenden Central.
Yes.
They will be here momentarily. So here's Senator Clarkson. Okay. If
Just don't worry, I
you
want
can
you to get
introduce
that
yourself
house.
and then and your staff or whomever, and what we're interested in is just an update of where you're at with the Medicare Advantage for state retirees situation. We just wanted to hear where we're at and what we might want to do or not do.
All right, well, thank you. I appreciate it. I am Beth Fastiggi, Human Resources Commissioner. I live in Burlington. So Senator Vyhovsky is actually one of my senators. With me is a Secretary of Administration, Kristen Klauser. Harold Schwartz, he's the Director of Operations for Human Resources. Clark Collins, there he is. He's our Director of Benefits and Wellness. And on YouTube is Steve May. He is one of our benefits consultants. He works for Hickok & Boardman.
Great.
Business Intelligence, Hickok & Boardman Business Intelligence, is that right? I don't know, they have a bunch of different divisions, so.
Okay.
It's all right. So I just wanted to provide you a little bit of background. The Department of Human Resources manages healthcare benefits for state of Vermont and state of Vermont employee state retirees. Our unions bargain the healthcare benefits for our employees, and those we're required to provide those same benefits to retirees. We contract with vendors to administer those benefits for active employees, and then two populations of retirees, the retirees who are 65 plus, whose primary coverage is through Medicare, and then the under 65 population, or the non-Medicare eligible population, who are just essentially treated just like the employees on the employee plan. And those for retirees who are Medicare eligible, those people are on a different plan that matches the same benefits. So Medicare is the primary, then our supplemental plan wraps around that and provides the coverage that Medicare doesn't. And we've been aware of Medicare Advantage plans for a long time, but group Medicare Advantage plans only recently became available in Vermont. So, we've had vendors trying to sell us kind of on the individual Medicare market for years, which really would not meet the needs of our employees, and retirees. That just wouldn't work for us. But at least every 4 years, we need to go out to bid for our benefits contracts. So our benefits contracts all expire January 1st, 2023. So we're in new benefit contracts year. They're big, complex contracts. It takes us about a year to procure them. So beginning in January of 2022, that's when we started, looking at all of our different contracts and putting them out to bid. And we decided at that time we should look at what type of what a Medicare Advantage program geared to our program would look like. So we put that as kind of an exploratory model in our bid documents. During that process, we had shared the bid documents with the VSEA. They reviewed those documents. They actually provided feedback on those documents. So this is about, this is in the spring. We also were encouraged by the Treasurer's Office, who had recently switched to Medicare Advantage group program for their retirees, to explore that option. Also, the Auditor's Office had been encouraging us to look and see what the Treasurer was doing. They saved a lot of money on their other post-employment benefit liability. So for all those reasons, we just okay, let's take a look. We were, I would say, skeptical that they could really match our plan, because our plan is fantastic. It's great for our employees and retirees. So could they really design a plan under the Medicare Advantage contract that matched that? So when we got the bids back, we were really interested. We became more interested because the pricing was really good and they said that they match our plans. So when we did the finalist presentations, we also had them present on their Medicare Advantage proposals as well. We had union representatives in those meetings as well, so they were aware of the presentations back in, those happened in June. So after the presentations, we were pretty impressed, and we're like, okay, there's a lot of savings to be had. The benefits are better or equal to. And so we really need to explore this and dig in and see if this is a reality, or just see how real it is. And so the benefits that we found, just kind of going to review them. First, the financial. Overall, about a $9 million savings annually to be split between retirees and the state. So they pay 20%, we pay the 80% match, which would translate to about a 20% savings on average for the retirees. Let's see, other advantages, financial. Well, in addition to the, I did mention about the OPEB liability, we estimate that there would be at least $100 million in savings, maybe more. We would have to have the treasurer's actuary actually look at that.
Would that be over 1 year or?
So this is the OPEB liability, so that would just
Oh, I see.
reduce the
Yeah, yeah.
liability up front. So
Got it.
we saw that liability decrease when we began to pre-fund that. So that had a big impact on the OPEB liability as well. So we've made some real strides there, but that has the consequence of the state agreeing to put significant money towards those liabilities every year. This would reduce the liability without that requirement and leave money for us, the state, to do other things with. So it's a big advantage, and that's what we saw with UVM when they adopted a Medicare Advantage plan, as well as Vermont State Colleges and the Treasurer's Office again for the teachers. We saw them also have significant reductions in their OPEB liability, which is really important, and something I know the legislature has been actively interested in reducing over the years. Also, we would get predictable premiums over the next 3 years. The enhancements, just a few of the enhancements, decreased co-pays for things like chiropractic and acupuncture services that we have for the employee plan, and increased dollar cap for vision benefits, and just a whole host of other benefits. When we did a side-by-side comparison, the vendor that had, that we were really digging into and have been working with would either do equal to or better than what we would provide. So the hearing aid benefit, which was actually new for our employees just beginning in January, there is better by a lot, actually about twice as good. And some other benefits too, Harold. What other benefits were?
One that stands out is skilled nursing facilities. The current plan that we have for actives, 60-day limit in a year. This is a 100-day limit in a year. That's pretty significant.
So a lot of things like that. So we continue to dig in. We knew that Medicare itself doesn't provide coverage for things like naturopaths, which our plan does. So we made sure we had like an extra rider in there, and then that would be covered. We made sure that mental health coverage would be provided, because the Medicare guidelines for mental health coverage kind of have a higher standard of provider licensing than really is widely available in Vermont. So we want to make sure that the current network and those providers that employees and retirees are using now would be available in the future. So we felt like we had vetted it pretty well. Once we felt like we were ready to move forward, we reached out to our labor partners, as well as at the Vermont Retired State Employee Association, and we said, hey, we're really excited about this opportunity. We want to tell you about it, and we want to hear some input. We want to hear some feedback. So that's where we've really been since September. And we're kind of still in that phase. I mean, you're hearing, I would say that the Vermont Retired State Employee Association has been more receptive to providing feedback and kind of digging in than our labor partners have been more like, no, we really don't like this. We don't want to look into this, and providing information that is not really factual, which is unfortunate. So we're trying to just get out there and let people know, here's what the facts are. And the other thing that we really are asking retirees, asking anybody, if you know of issues, or if you think there might be an issue, let us know so we can do the research and investigate that and see if it really is an issue. Because if there's something that's gonna stop it, that's not gonna enable us to have the same coverage, then we're not gonna move forward. So that's what we're really looking for, is if there's something that we missed, if there's something that you see, let us know so we can either ease your mind or move forward. I'm trying to think if there's anything else that I wanted to say. I'm just kind of looking around the room. Secretary Clauser, did you have anything that?
Well, just in terms of the status of where we are, I think the commissioner said we are in negotiations. I don't think that's officially true. We have requested, I've sent a letter to the union requesting that they sit down and open negotiations and bargaining for this. We haven't had a response from them yet. They are not obligated to bargain mid-contract. So we don't know what their response will be, but the administration is not forcing this on retirees. That's not something that we're doing. We're hoping that our labor partners will engage and negotiate, and we're gonna run down issues as they come up. And, to the commissioner's point, if this is not a good fit, then it's not a good fit. But in terms of where we are status-wise, we have sent out a request to VSEA to have them sit down. And
is that a sort of official request to
It is.
negotiate? Okay.
yeah, it is.
And do you mind actually coming over here?
Oh, sure. Am I off camera?
Yeah. Or
Sorry.
unmiked, it's a little awkward. No, you were fine. We can,
Here, I'll sit.
yeah. Sure, perfect.
Okay.
And you're fine. You were on camera when you said it, so
Okay.
so people would
Okay.
see you and everything, because our camera does this little
Ooh.
Like a big brother.
but yeah, it is. But so I don't need you to repeat everything, but I just want
to identify.
Oh, yeah, and-
Oh, I'm sorry. I'm Kristen Clauser, Secretary of Administration.
yeah, she introduced herself at the beginning, so
Oh,
thank you.
sorry.
It's really nice to
That's
meet
okay.
you, Madam Secretary. We didn't actually go around and, yeah, we did
Yes.
introduce ourselves, so
I'm
thank you for coming. So just for clarity's sake, I don't know if you saw the testimony from our legislative counsel, Damian Leonard. He testified to us sort of like his legal interpretation of the language, and really the way that our legislative attorneys, and I don't want to speak for him, but he's on the record saying this, is that they don't feel like the administration has the authority under statute to just make the change. That it's pretty clear that the employee retirement benefits have to be equivalent to current employee benefits for health insurance plans. And that if there's this sort of small slice where you can thread the needle carefully, where if the current employees who are beyond the age of 65 have certain benefits then that have been negotiated, then the retiree benefits could be the same as those benefits of people who are over 65. If you haven't seen it, I encourage you to listen to Damian's testimony. So we are taking the stance that really you can't move forward unless you negotiate it, or the legislature gives you the legal authority to do it. And I just want to hear, are you in agreement with that assessment, or are you interpreting it differently?
So we are not going to unilaterally move forward.
Okay.
We've requested to bargain.
Okay.
And if the union, doesn't bargain or refuses to both reopen the contract to bargain with that, we are not going to make a unilateral change.
That is great to hear.
And just to, and I'm sorry,
No, go ahead.
but you mentioned same benefits. I just want to they are the same benefits. And I think the testimony was related to benefit plan, the same health benefit plan, right? And currently, folks who are Medicare eligible and over 65 are not on this, as the commissioner referenced, they're not on the same health benefit plan as active employees because they are on Medicare. And then there's a wrap to make sure that they have the same benefits that active employees have. But I did want to assure this committee, and I had sent a letter to the pro tem and the speaker. We are not unilaterally going to make this change.
Okay, that's great. If you could share that letter with us, so
Sure.
we can put it on our, and also your testimony, it looked like you were reading something that would be helpful.
Yeah,
if we
probably.
could-
Takes a little bit.
That's
Take out the typos.
More of an outline.
Take out the typos.
However you want to fix it, but, and then we can have it also, and I guess one of the things that we're hearing, we're gonna hear from a few retirees and then also the union representatives, but, and I also serve on the healthcare committee, so I've done some work on, Medicare Advantage plans, and one of the concerns with them, just sort of overall, is that they may sound really good on the front end, but on the back end, they will deny coverage and really sort of make it difficult for people to access their benefits. And I don't know if there's anything in the proposal that you've received that would, would prohibit that kind of practice on the back end, because I think that's really the fear, is that once you're a couple of years down the road and everything seems to be going well, then you get into this situation where somebody really needs healthcare coverage because they have cancer or something and they're denied benefits. So yeah, I see you, Allison, but go ahead.
Sure. So yes, in that this is not an off-the-shelf Medicare product that we're buying. It would be a contract that we would negotiate with the administrator. So, but there are ways to through that contract, build in some metrics if that's the concern, some access promises if that's the concern. Try and dig into that particular issue, which is an access issue as opposed to a benefit issue. I think is what, or
Well, it's both. It's both because
I mean,
it's
the
really
benefits are
their,
contracted benefits, so they would be obligated to provide the benefits that they've contracted for. However, I think your question is, well, what if there's a denial of those benefits, right?
yeah, I think that's pretty common if you hear about the concerns with these benefit plans. is
Yeah.
that they get denied on the back end, and also that the customer service for a lot of these plans is pretty inadequate, and that people who are on them can't often get their questions answered. And this is just Medicare Advantage broadly speaking.
Sure.
Not the specific
Yeah.
one, but.
And we do have some customer service provisions that would be built into the contract to address that particular issue. We also have Clark and his team who currently feel, when any active employee or retiree has concerns about their benefit and calls and complains, there's been a denial, or they can't get a prescription covered or something, they call DHR, and DHR reaches out and acts as a liaison with the insurance company to try and answer those questions and provide answers to the question, but also advocate for the employee to get coverage. That the DHR team would continue in that same capacity under this plan. There would be no change. You can still call DHR and they would act as that liaison and advocate. But Beth had indicated Steve had some specific responses.
The only thing I would add to that is that specifically we have performance guarantees given in the proposal that would address some of those issues you're talking about for the state and the contract of the state. Service, time to pay, time to answer phones, all those things like we do on the current state contract, we had built in and had proposal for those performance guarantees on the Medicare Advantage also.
Okay. Senator Clarkson, did you have a question?
Yeah, well, it just two things, well, actually three things sort of sparked my interest. Beth, you said that you'd met with the retirees, the Vermont State retirees. Are you meeting with them separately from meeting with Steve and company?
Yes, so there's two separate groups. There's the Vermont Retired State Employee Association.
Right.
We met, Clark, Steve, myself, and Harold met with them in September. It was for about 3 hours. Shelley is the president of that association. The VSEA is, they're our labor partners. So we have also met with them separately. And we have a benefits advisory committee, which is kind of a joint management union committee that we meet with quarterly as well. So we have had larger discussions, I would say, with the benefits advisory committee. With the VSEA, I would say our discussions have been limited.
Okay.
And Al, if you want to add anything to it.
So, and then the second thing
But
was.
not without trying. I mean, we really want to engage them and get the facts so they can provide the facts to their members and their retired members as well.
So you said that this plan was good for 3 years. What would be open after 3 years? That the contract's open for renegotiation or?
So the vendor that we're working with provided a 3-year guarantee of their pricing. Typically, our contracts we go 2 years and then we do 1+1. So we usually extend them if we're happy with the service, things are going well, we'll extend them each for another year. In reality, we have provisions in the contract where if we're not happy with the service, we can terminate the contract. Now, we would need to have someone lined up we couldn't realistically terminate something in 30 days because you would have to have another vendor lined up to provide that service. But we have clauses to terminate. And every 4 years, we have to go out to bid anyway. So we would go out to bid again and do all the evaluations again and look at the best value for the state and our employees and our retirees.
So, and my third question is, have you spoken with other states or firms that use this Medicare Advantage program, and how are their employees feeling about it?
So number one, this would be our Medicare Advantage program. It's not this one because ours is unique to us, self-designed to us.
Okay, so have you talked to other employers and or states or whoever that have used this company and found them to be credible and?
Yes, the Vermont State Colleges in particular are using the same vendor and are very pleased with the results.
So when you say vendor, it's an insurance
It's
company?
insurance company, yep.
Okay.
And UVM just switched from Blue Cross Blue Shield to Cigna. They just switched in January.
So the vendors,
They were,
That's
yes,
the vendor that we've been negotiating with. We got bids from three vendors.
got it, okay.
For Medicare Advantage, 2
So-
bidders for a regular healthcare plan.
And so the state colleges have been on it for how long? And UVM just switched, but the colleges have been on it for how long?
Steve, do you know?
Just more than a year. So they were 1/1/22.
Okay, so they don't have a long experience, but any feedback? They're happy so far with the
Yes,
That's
retired
what we understand.
retirees are reasonably happy so far?
that's what they report to us.
Senator Bielski?
I just have a clarifying question. So my understanding is that Medicare Advantage plans are not Medicare. They are private plans that are outside of the public Medicare system. Is that correct?
So I think I'm gonna turn that one to Steve because it is kind of nuanced and it's, right, go ahead.
They are private plans managed by and overseen by CMS and mandated to include the basic Medicare Part A and Part B of Medicare. So yes, they're private, but they're still overseen by CMS. And they're
CMS
mandated
is
to
the
have minimum benefits.
Center for Medicaid and Medicare Services.
So they
Oh,
are
yes, sorry.
out of the public Medicare system and putting them into a privatized system.
That's correct.
Thank you.
And 60% of Medicare eligible folks are now have moved to Medicare Advantage programs.
I mean, there are sort of health policy and finance issues with these plans, just similar to what Senator Bielski, I think, is referring to, that are problematic for the Medicare program federally now.
And I just want to say, my job is to get the
Yes,
best value
understood,
to
understood.
get the
We're not
best
gonna-
value to the state and
Yeah.
use the incentives that Medicare and CMS is providing, taking advantage of the the incentives that Medicare and Medicaid services are providing to the private insurance companies and having us take advantage of that in the terms of better pricing.
Yeah,
Yeah.
I wouldn't pretend that you're responsible for the whole big, I mean, holy cow. But it is worth noting, and I think that's what Senator Piwoski was referring to, is that there are issues on a sort of larger scale that are concerning for our national healthcare system, but
Yeah.
Senator Watson.
I think you, well, so I've got a few questions. So it's encouraging to me that there were 3 bids that were submitted for this potential plan. Was Cigna selected that you're negotiating with on the basis just of cost savings? Like, was that the only metric, or what were the metrics that you used?
We looked at cost, we looked at their actual program and plan, and also what they were providing in addition to what we were asking for.
Also, their, sorry, just to add, the pharmaceutical plan that we currently have, the pharmacy plan, is administered through, well, it's Express Scripts, but they're owned by Cigna. So using Cigna also allowed us not to have to change the formulary and the pharmacy benefits. So the pharmacy benefits, which is incredibly important to this population, would stay the same. So that was another
Yeah,
consideration.
and I think Steve can add to that too.
Yeah, and I would, so that would mean no change for the prescription drugs. Cigna was the only one that had that absolutely formulary, and the drugs that are covered and the benefit would be the same. But we also took a look for each of the providers. We had all of the physicians and facilities utilized within the last year by Medicare eligible retirees. And we compared that list to what would be available with each of the providers too. So we were also cognizant of what this would do for access for each of the providers.
Yeah, fair enough. Thank you. I have just heard from some folks about concerns about Cigna in general, you know, some of the issues that they've had around the country. I don't know if that's like, there's a way to even capture concern about that in a bid process, but just wanted to at least bring. Yes, go ahead. Yeah.
We did follow up because we had those concerns too.
Okay.
So like Commissioner Fasigi said, that one of the reasons we're reaching out and wanting to speak with everybody is to understand the concerns. We followed up with some of those concerns, and within the last 2 years, as I stated, CMS the Center for Medicare and Medicaid Services oversees these plans. They rate these plans. Cigna has been through the rating process a couple times since there were some complaints regarding handling issues of reviewing claims. They've been rated 5 out of 5 stars. They've passed audits favorably since then, and they've had favorable star ratings from CMS in all categories, greater than 3 stars. I think their rating right now is a 4-star rating. So it's a constant rating and review from CMS. And since the initial complaint that has been asked about, they've passed audits and had good ratings.
That's very helpful. Thank you. Can I ask you?
Yeah, go ahead.
So I'm also encouraged that you are that you had reached out to retirees and to labor. I'm wondering if you had done any polling of any of those groups, or maybe that's not. I don't know. Maybe that's not your role, but
What's the
Survey, yeah.
question? Survey.
if you did any surveys of folks' opinions on this change.
No.
Not in advance.
Not in advance, yeah.
And that's where we fit in. The
Okay.
polling is the emails we've gotten.
Yeah, fair enough, fair enough. And I think that is the only.
Okay.
And just to add to the Cigna portion, it's not with relation to Medicare Advantage, it's just Cigna, but there's some information on the DFR website as well that ranks number of denials per year for the 3 insurance companies that are in Vermont: Blue Cross Blue Shield, MVP, and Cigna. So there's good information on that too, with respect to with Cigna as an insurance. Again, it's not a Medicare Advantage plan, but it's a private Cigna health insurance plans.
Yeah, thank you.
Senator White, did you have a question or was it just, okay?
Yeah, thank you,
Go ahead.
Senator. Chair Harvey.
Man, Becca.
Very formal here. So I just have kind of a general question, which is it feels like for me, what I'm hearing from constituents is that this recommendation doesn't pass like the straight face test. Like if this is a plan that is better and costs less money and is moving to private, where are the efficiencies and the savings coming from? It feels like, to me, what I've experienced as an individual is those savings tend to come from me as an individual getting less good. So I'm just wondering, where are these savings and what's changed that makes this so much better?
They're heavily subsidized by the federal government. So the savings is because they receive a subsidy from CMS. And they're able to then reduce their rates reduce our rates as a result.
So it's basically the CMS, the federal Medicare trust fund is subsidizing private plans. And that's why it's.
Yeah,
they're
it's a bad idea, but that's not for you.
Right, no, but that's right. No, that's.
It's
happening.
Yeah, incentives are available.
See, these are non-health and welfare.
We should be able to take
But-
advantage of the federal.
Why
Yeah.
would we undermine a product we all love and trust, Medicare? Why would we do that?
So I
don't
will
get it.
stop, I
I
will
think
stop,
this
and and so I hear you.
Sorry,
This is a-
Yeah, no, just the way you stated that question, Senator White, was great. It was an excellent question. And your answer was honest and true. And this is unfortunately not the venue for us to be having this discussion. It's a larger healthcare policy issue. We talked about it last year on Senate Health and Welfare. I think we're going to try to get back to it. We are very limited at the state level as what we can do because it's Medicare, it's a federal program. So unfortunately, we have limited ability to impact the policy surrounding this. And it's a fair question to be asking.
Yeah.
We are running behind, so I'm gonna give Senator Vyhoski just a couple minutes and then we're gonna move on to our next witnesses.
Well, and this may be getting to this point as well a little bit. So when you say you looked at provider access, what does this mean? Did you simply go down a list and look at what providers accept Cigna? Or did you also look at the reimbursement rates that Cigna gives? Because I know as a provider, Blue Cross Blue Shield reimburses me almost twice what Cigna does. And what that means is I have to limit the number of Cigna patients I can take because it doesn't pay enough to keep the lights on.
This
And
is a fully insured product, so we don't have access to the reimbursement rates, but we understand underneath this that all providers would be reimbursed at the Medicare level and some a little bit better than the Medicare level. So we're talking about a Medicare plan. They would be reimbursed around the same that they get reimbursed currently. We didn't look at the fee schedule. We wanted to know that if I'm seeing Dr. Smith, that I'm going to continue to be able to see Dr. Smith. So the doctors that were seen were, there's a list kept of doctors that don't accept Medicare. And so the list that was available for utilized doctors by state retirees was run against that list. We didn't have any of the providers that are utilized match any that were defined as not accepting Medicare. And again, remember, this is broader than just Cigna's network. What we've done is we've expanded the network to anyone that accepts Medicare would be considered a covered entity.
Okay, thank you. We're gonna have to move on, but I just want to I would love to hear you sort of summarize where you're at with this right now in terms of whether, how and if you're moving forward. Either of you, it sounds like you're not gonna be pushing it forward. You want to negotiate with the union over it. You want to get feedback. Is this?
That's exactly right. We are not unilaterally forcing anyone into this plan.
Okay.
We've requested to open negotiations with the VSEA. We haven't had a response yet.
Okay.
And in the meantime, we want to hear people's questions. We want to run down answers and, answers to those questions and concerns.
Two more coming. Oh, wait, don't shut the door on her. She's trying to bring chairs in for you.
Terry.
Thank you so much. Sorry.
And two more on the way. If there are, concerns, we want to address those and run those down. And if we can find answers, we want to find them too.
Great. Well, thank you very much. We just got the chairs in time for you all to.
We're all building a row.
But, you're welcome to stay and hear the rest of the testimony, and we really appreciate you coming over here in person and speaking with us.
Thanks for having
today.
started the
Yeah.
crash.
No, not at
No.
all. It's nice to have folks in the room. And we want to play almost literally musical chairs. And have up to the table Shelley Martin.
I'm gonna have Joe go before me.
Okay, Joe Patrici.
Thank you.
Okay. And I have a fairly hard stop at 4:15, 4:20.
Okay.
So, and we have a few witnesses, so if we can.
We'll do the best I can.
Yeah, you heard us introduce ourselves, so
Sure,
why don't
I'm
we
happy to
just
go through
turn it over to you, you introduce yourself, and then let us know what you'd like us to hear.
that. Absolutely, and thank you for the opportunity to be heard,
Sure.
because I have not been heard by this administration at all. So let me start there. My name is Joe Patrici. I started working for the state in 1970 as a correctional officer. In 1986, I got appointed by Governor Cunin to be Commissioner of Corrections. I got reappointed by Governor Snelling to be Commissioner of Corrections. I left that job in 1991 and went to the Welfare Department to work for Jane Kitchell. Was a great boss. And then I became Deputy Commissioner of what the Welfare Department became, Economic Services, from 2005 to 2010. I retired from state government and became Executive Director of Northeast Kingdom Community Action, and it's a poverty agency for 8 years up in the Kingdom. So last October, my wife got diagnosed with myelofibrosis, which is a fatal cancer disease, blood disease.
I'm sorry.
We're in the UVM oncologist's office, and he's talking about sending us to Dana-Farber because it's a rare disease, and that's where they've seen these and they can do these. It's going to be a bone marrow transplant that can cure her. It's going to cost $300,000. The first thing they asked us when we got down there was they assigned us to a guy named Hugo, he's a financial consultant that works for Dana-Farber. What's your insurance? So we told them, and they said Medicare will pay for 80%. Blue Cross Blue Shield will pay for the other 20%. Blue Cross Blue Shield called us up personally and told us they wanted to relieve us that we were approved to go on this. So we're going through this. That was early December. Before that, in October, I'm reading the New York Times. A reporter by the name of Reed Alderson wrote a story that you can look up about how the privatization of Medicare has built the Medicare trust fund in the billions of dollars for fraud, overpayments, all kinds of shenanigans, denials, delays. Read the article. I'm saying to myself, are you kidding me? Wow, that's terrible. And then I read Vermont Digger, and I see that the administration is going to unilaterally decide to switch our health insurance from Blue Cross Blue Shield to Medicare Advantage unilaterally at the time. I'm like, whoa, no, please don't do that. I email the governor. I get back a sales job and how great this is going to be. We're going to like it. I know what's best for you. No problem. And I'm like, effective January 1st. Really? So now I'm panicking. So then the next thing I know is there's more, I call my retired group, my retired club of colleagues up. We put the press on. I meet Shelley. The next thing I know is, well, we're holding off on it. And I'm saying to myself, okay, that's good. Then I read in the New York Times that Cigna press release from the United States Department of Justice, press release, which I gave to the clerk that you can read, is suing now, currently, Cigna for Medicaid Advantage payment fraud in the millions. So their 5-star rating, seriously? When I was in my jobs and I had contracts to pass through and be vetted by the Secretary of Administration, if I had gonna hire a company with that kind of, that was currently under the lawsuit of the DOJ, it would have bounced like a bad check. And they would have said, what is the matter with you, Commissioner? Do some due diligence. Even worse, when I Googled Cigna, 2016. It got suspended for 16 months by CMS for what? Medicaid, payment advantage, excessive system failures, excessive out-of-pocket denials, excessive out-of-pocket costs, denials, delays, appeals. People didn't get their medical services. They were sanctioned, suspended from selling their Medicare Advantage products for 16 months. Forgive me if I sound angst about this, because I am so outraged by what I've heard today. It's such a scam and sham. These people are shining you on. I can't believe it. So I decided.
I'm just gonna say, we need to tone it down.
Okay.
And it's
sorry.
the best intentions with people.
All right, I'm
who
sorry.
are here.
So I emailed the governor. The governor, I can't get through to. I emailed his press secretary. I emailed the secretary of administration. I emailed his lawyer. I emailed all these people. I get nothing. Today, I did get something from Kristen that said she'll pass my email a couple of days ago to the governor. The governor seems to be so insulated that he doesn't seem to understand the angst here. So now we're working with the legislature. We're just panicked because you're going to put our healthcare in the hands of the Cigna Corporation, and they're under investigation by CMS and the DOJ for payment fraud, and they have a history of suspension. How did they ever get chosen? I don't get this. Forget about whether it's the same benefits or not. Look at the vendor. Same benefits? Seriously, the whole game that the privatization plays is through the access points. Denials, delays, pre-authorizations, payment rates to the providers. There's a bunch of providers that dropped out of the Mayo Clinic because the payment rates dropped. And they're not seeing those patients anymore. And that's the game they play because they're for profit and they make all this money. They get paid by Medicare trust funds and so on and so forth. So
Okay, yeah, Mr. Patrizzi, we need to keep it to the topic at hand, which is right here. We can't solve all of the healthcare system
all right.
problems, unfortunately. in
So
this
I'll just wrap it
room.
up.
So, yeah, that would be great.
Sure. So here's my concern. Now the administration wants to bargain. They want to bargain. My speculation is because they got the message. We push back. This is not going to work for them. They don't want language in the law to forbid them from privatization of our healthcare. Bargaining is supposed to be done in good faith. Good faith. That's what bargaining is all about. The faith has been gone. It's gone because of this game they played. So my request to you is to please put language in some bill to prevent the privatization of our health insurance. That's my request. Stop them from doing this. I loved the governor. I trusted him. He gained my trust during COVID with his weekly press conferences. I don't know who he is anymore. So that's my testimony. Thank you.
Thank you very much.
Thank you
Mr.
for letting me.
Patrizzi. My pleasure. Yeah, would you like to come up? Shelley Martin. Welcome back.
Thank you. When I was here before, I already told you who I represent and everything, so I'm not going to go through that. I'm just.
Actually, we need you to do it for the record today.
Oh, okay. I'm
Remind us
Shelley
all.
Martin. I'm currently the president of the Vermont Retired State Employees Association, and I'm the past president of the Vermont State Employees Association.
Great.
So I have a well-rounded idea of what's going on. I do want to give a really quick testimony, but I want to clarify something. The VRSEA did meet with the administration right away as soon as we understood what was happening, because we wanted to understand what they were doing. We asked 3 hours worth of questions, and they answered a lot of the questions. The ones they couldn't answer, they responded back to us, and we feel that we showed them that if 10 people from our board and a couple more from other committees couldn't get our questions answered, they weren't ready to produce anything January 1st. And we made it really clear to the administration, you're pushing this, and we feel, that we oppose it because first of all, we didn't understand. We've never seen a contract. We don't know exactly what it says. And we didn't want to have anything privatized. We actually have the best insurance of anybody. Our state insurance is excellent because it's based on the needs of the people. Mm-hmm. It's not based on money at all. I have had cancer twice. My first surgery was in January of 2000. My last was October of 2008. I had to have 31 surgeries to survive. I was under the care of Cigna managing it and Blue Cross managing it. So I got a feel for both companies. And they treated me as if they were my insurance and I wasn't the state of Vermont. They denied me on a regular basis.
Who did which?
Both companies denied me several surgeries. I had to call the benefits office and they overrode it, so I was able to get my surgeries. In January of 2003, my blood work showed that cancer was growing again, and I had to have a lot of scans and tests done to see where it was. It took me 6 months. In those 6 months, even my blood work was denied, but the state came through and I was able to have it overturned. I had very good success. Everything I needed was actually taken care of, and it would not have been if it would have been a private company who was denying me all the way through. My last surgery was urological reconstruction. It was in the Leahy Clinic down in Burlington, Mass, which I would say is the best that I've had. I've had surgeries in all the hospitals. In Vermont, we have good surgeons. But I had to be there the day before so I could be prepped. I went into surgery at 7 in the morning and it was a 12-hour surgery. And I was denied. And I called our benefits office. Within an hour, it was taken care of and I was able to have my surgery. If I hadn't, and I was able to stay the night before, if I hadn't had that surgery, I would have been dead within a month. And happy to say, I'm not on any medication. Our surgeons in this state were excellent, and my surgeon saved my life in the end because of all of the good work our doctors in Vermont had done for me. A privatized company is just nothing the retirees want. I sent a letter out to over 8,000 retired state employees and put my phone number in it.
Oh.
Which I hadn't really realized what I had done. My phone messages are constantly full. I'm constantly calling them. I have probably since our newsletter have talked to hundreds and hundreds of state employees that are not only fearful for their lives, but they're also fearful of being impaired. And as seniors who are facing the end of life, we want to live as long as we can in good health with a good quality. And to have us be scared half out of our wits that we're not going to be able to have what we need to survive because it's money oriented on this private company instead of people oriented. The stories I've heard are so frightening, so frightening. And I've cried with people on the phone. So just thinking of them is emotional.
Yeah.
Because they really are scared and they don't want to be forced to somebody, God bless you, to have somebody take care of them that is not oriented to their health, that is more oriented to money. Because money is not going to save their life. It's the passion that our state has for us. And I think, you know, one of the benefits is the protection of bargaining from VSEA to be sure that our benefits are good. And it's the statute that says that we get what we had when we were working, when we retire. And I don't think our seniors should be faced with having to worry about their next step to survive or have a good quality of life.
Ms. Martin, thank you so much. I'm sorry you've been through so much. You're obviously an incredibly strong woman. It's kind of amazing. And thank you for being with us. So I just sort of like I did with the commissioner and the secretary, I want to just have summarize where you're at. You heard their testimony. Are you comfortable with where we're at right now with the sort of wait and see and bargaining, or are you?
I want the state to stop. Right now, just leave us alone. let us live our lives out. We donated our lives and our careers to this state, and we want the state to protect us. And so what I would like to see is for this to stop and just leave us alone and let us stay where we
And
are.
stay with the current benefit plan that you have. Okay. Thank you. I just wanted to make sure we could summarize it all at the end so we know where everybody's at. I appreciate your testimony. Thanks for being with us today.
Thank you.
We have one more person. I think it is Tom or Steve, which is. Oh, okay. I'm sorry. I was thinking other Tom.
Usually when I'm getting moved stuff on cemeteries. That's a rule.
Oh, well, gosh.
The testimony we just heard, I can't do justice to what they have been saying, but my name is Tom Giffen. I'm the president of the VSEA Retirees Chapter, and I represent retired members of the Vermont State Employees Association. I spent 40 years in state service. I started out with the AOT, which is not called AOT anymore. I worked with SRS and I ended up my career as the assistant superintendent of the Marble Valley Correctional Center. So I've been out in different positions, different times. Since proposed medical insurance change was announced, I received phone calls, emails, like that you've already heard from retirees that I haven't heard from for decades. Many are in other states. Very upset. They're doing issues of their own medication. Some are doing different with the hospital care, and they don't know what's going to happen. So when they saw this was going to be implemented on January 1st, I mean, they were just like, they were emotional, they're upset, so what's going on? And I really didn't have an answer for them because I said, all I saw was this was going to be happening on January 1st. It's been touted that the Medicaid Advantage provides a better, the same coverage that we have now. There's so many differences I don't want to get into, but I do want to share one story you already heard quickly. A close relative of mine is a retired state Vermont teacher. They moved the teachers, as we know, into the Medicaid Advantage program. And she had breast cancer 30 years ago, and she has to wear a special compression sleeve because of her lymphedema. And she has to wear a sleeve, and it costs around $2,000 to have it done. Every year she has to get a new one, sometimes twice a year. The state of Vermont Medicaid Advantage plan covered nothing. Then go to a deductible, and because it's not covered durable medical equipment. A lot of our retirees, I mean, that's something they have. So that's this one thing, this one person is saying that, they're saying what a wonderful opportunity this is for us. It isn't. And again, a number of people, I received an email from a retired state trooper down in South Carolina. And I think he still has his gun. But he was very, adamant about what's going on and why is this happening. He's been retired for over 25 years. This has impacted all the retirees across the board, and it's putting pressure on them, emotions that you've heard, and on behalf of all the retirees, we don't support any proposed changes. Once you retire, if you've been retired for decades, you should not be having to deal with your medical insurance changing. It's just wrong. And you've heard from other people already ahead of me what it's done to them personally. I know people who are having a lot of medical issues. They're wondering if they'll have the same opportunity, the same medication available to them by the time this session is over. And I don't think I can do anything more than that. But I do thank you for allowing me to testify today. And I hope that you will look at this very closely and see how much it is impacting people who should not have to be impacted when you've been retired for 30 years.
So I'm going to ask you to summarize as well, just so we are all, our legislative council attorneys believe that current law does not allow the administration to move forward with anything, that what you have right now is what is allowed under current law, but this change into a new plan would not be allowed under current law. And what I'm hearing from you, I think, is you want to stay on the current plan and you don't even want a negotiation on it.
Title III is very clear. I'm not an attorney, even though I stayed at a 7-Eleven last night. But the two sentences in Title III are very clear. We receive the same medical benefits as current employees. I don't know where that can be checked. I don't know how that can be interpreted any other way. Our biggest fear, though, that after the session ends, is that something might come out out of the administrations that's saying that we are going to change your medical care. But I can't reiterate enough that people who, like myself, 40 years in state service, should we get kind of medication just for that? But but I would think that I should not have to worry about my medical care, or for people who've been retired for 30 years, and all of a sudden they're saying that we have to do something, that we're going to change into a different, Joe Namath kind of plan, which I just don't understand.
Well, thank you, Mr.
Well, thank you very much for your time.
Are there any other questions?
Yeah, thank you for your time. Thank you for joining us today. We appreciate it. And thank you to everyone in the room for coming today. And, did you want to testify?
I apologize. My car wouldn't start, so I got here late and didn't sign up.
Oh, yeah.
But if I promise to keep it to 1 minute and bullets,
Yes, that would be fine.
Thank you.
Yes.
and I do promise.
Okay.
My name is Terry LaFave, Teresa LaFave, and I am a retired health department employee of 40 years. I've been a VSEA member for 50 years. I'm currently on the Benefits Advisory Committee, and I'm also on the Retired Employees Committee on Insurance, which is a government appointed labor management advisory group. When I heard Steve today say 2 years ago we started looking into, my head nearly exploded because we didn't hear anything at all about this until autumn. We've been asking for years, what's going on with Medicare Advantage? Oh, nothing. No, we're not interested in that, nothing. And then we get a letter saying as of January 1st, you're going to be on Medicare Advantage. VSEA cannot negotiate retirees' benefits. They negotiate benefits for active employees, and by law, retirees get those same benefits. And Medicare Advantage, another big concern we have is if they contract with Cigna, it's a private company. What happens when that contract expires? No one has any oversight about the benefits or the cost. Are they going to keep the same program? Are they going to charge us more? Are they going to drop benefits? And who's going to negotiate that? Because the state's going to be completely out of the picture. They're telling us they're going to save $9 million. Where are they going to save it? They've yet to show us that. And where's that money going to go? Is it going to go back into the employees' health care plan, the current employees' health care plan? Because that's the plan that they're saving money on, right? If they're not paying for retirees, are they going to put the money into the active plan? I doubt it. And who do we go to for resolutions? If we have problems, right now we can call local Blue Cross Blue Shield, talk to someone we know. Or we can call Clark Collins, bless his heart, and pester him forever. But who will we call when it's Cigna? We will have absolutely no control over what our benefits are, over what the costs are. I worked 40 years for the state at a lot less money than I could have made in the private sector because we have a good pension plan, which the governor's also trying to mess around with, and we have a good health care plan. And being a single mother with those two plans, I'm hoping I won't be a burden on my son in my final years. Don't do this to people. Write legislation that's firm and strong and goes with Title III, saying this is the law. Retired employees stay on the same benefit plan as active employees. And we pay for it.
Okay.
And we paid for it throughout our career, for that matter.
Thank you very much for your time.
Thank you
It does
for
sound like
allowing
there
me to
are some
speak.
communication things that need to happen, because I think there were some of the questions that you asked that had been answered earlier, and maybe you missed them. So it does seem like there's some communication that needs to happen between the parties. But we've heard you loud and clear for sure, and obviously this committee needs to discuss it a little bit more at another time. But thank you so much for I'm sorry about your car, and I appreciate that you came. And
It's
spent some time
17
with
years
us.
old and it started with a jump. I'm happy.
Wow.
And it's the original battery.
Thank you,
I need
everyone in the
healthcare.
room
Yes.
and who's listening. I really appreciate your time today, and what to be continued, it sounds like. So